This episode of the Modern Therapist Survival Guide is brought to you by Thrizer.
Thrizer is a modern billing platform for private pay therapists. Their platform automatically gets clients reimbursed by their insurance after every session. Just by billing your clients through Thrizer, you can potentially save them hundreds every month with no extra work on your end. The best part is you don't have to give up your rates. They charge a standard 3% processing fee.
Listen at the end of the episode for more information on a special offer from Thrizer.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt with Katie Vernoy, and this is the podcast for therapists about all of the things that affects us in our practice. And admittedly, from time to time on the podcast, Katie and I invite guests on because these are things that we want to consult on for ourselves. And being in a profession where, frankly, we just sit on our butts for a lot of the day, I've experienced, and a lot of my colleagues have experienced way too early in life, things like lower back pain and hip problems. And we see all sorts of discussions about buying $12,000 chairs in some of the Facebook groups. So we invited our friend Celina Caovan. She's a doctor in physical therapy to tell us how we can do better in our practices and also about the interplay between physical therapy and mental health. So thank you very much for joining us.
I'm glad to be here. Thanks, Curt, for that introduction.
We are so excited to have you here. I will claim you. You were my physical therapist and absolutely the best ever. And so I'm so glad you agreed to come on and share your knowledge with everyone, not just me. But the first question that we ask everyone is, who are you and what are you putting out into the world?
That's a great question. So as Curt said, my name is Celina, Doctor of Physical Therapy. I graduated from the University of Southern California. That's where I got my degree. I'm currently working in an outpatient orthopedic setting as a physical therapist. And the question to answer, as a physical therapist, when I put it out into the world, my goal is to educate people about, their bodies, their movement, and by doing this, hopefully managing their pain and preventing further injury and just improving overall quality of life. And I do also want to say, I admire what you two do as mental health therapists as well. And I feel honestly grateful to be here to provide tips to help therapists like you help yourself so you can help others. So I'm happy to be here.
Awesome. Flattery will get you everywhere on this show. I know that physical therapy, some of our audience has experienced it before. Can you first just kind of lay out how physical therapy fits into the health world, what it is, and how people can benefit from it?
So to sum up physical therapy, we have an official catchphrase. So we say physical therapists improve the way you move. So that's our catchphrase. So physical therapists are trained movement experts pretty much. So we can diagnose, we can treat using hands-on skills, patient education, and then we prescribe individual exercise for a bunch of different injuries. So, but the ultimate goal being to improve the way someone moves and emphasize, injury prevention. And the cool thing about physical therapy, it can be an alternative to, pain medication in a society where they prescribe a lot of pain medication and then surgery as well. So some people can come in, they go through physical therapy and they can actually avoid surgery, which I think is really, really great. I think people that can benefit from physical therapy, honestly, is everyone to a certain capacity. So I think to address, current physical impairments, looking at their current physical activity, you can address current injuries and then prevent future ones. And another great thing is that there's physical therapists in all different types of settings and specialties. So not only in this orthopedic, situation that we're talking about, which is musculoskeletal, but we're looking at like neurology physical therapy. So that's people that have Parkinson's disease, MS, things like that. There's therapists in the pediatric setting, cardiopulmonary. So I think a lot of people can be affected by physical therapy in a good way.
I think there's a lot we can get into with physical therapy. I think it's amazing. I've told you I've become like a physical therapy evangelist because it's been so helpful to me. Because I joke my body's kind of a mess, and so I'm basically working on everything. So
Right.
I'm getting the full benefit of Celina's skills. But I think part of what you and I've talked about is I just sit all day, and Curt was already mentioning this, that therapists are pretty sedentary, except for folks that are doing some sort of movement or getting outdoors and walking and those types of things. We're pretty sedentary. And so I think the question that we typically ask is, what do therapists get wrong? But I'm going to just switch this around and say, what are the worst things that people can do when they have a sedentary job?
Right. So I understand the nature of your job is to sit for hours a day. That's what you do to treat, your clients, your patients. But honestly, the worst thing you can do is to maintain a sedentary lifestyle, like outside of your job, right? So lack of regular exercise and having that sedentary habits and lifestyle can increase your health risk. And I feel like a lot of people do know that. So honestly, moving a little bit, increasing your physical activity, even if it's by a little bit, can actually improve, your health benefits as well. Like some is better than nothing at all. So I looked up, some physical therapy or physical activity guidelines from the U.S. Department of Health, and they have something really structured so that we can, work with here. So they say with increased benefits, obviously people should try to move more and sit less throughout the day. That's a given. But just to give it a little bit more of a guideline here, they say adults should do at least 150 minutes a week of like moderate intensity aerobic exercise. So that's, that could be walking, that could be your biking, that could be your swimming. That's your aerobic cardiovascular activity. And that's about like 2 hours and 30 minutes, which I think is reasonable throughout, a week's time.
And I'm assuming that doing that all at once, like on a weekend, is totally appropriate.
Let's discuss that next, okay? That sounds like something Katie would do, really.
Yes, it is. It is. I am a weekend warrior.
She's like, let's make up for all this sedentary sitting and let's work out for 5 hours. So we'll talk about that later on. Okay. But moderate intensity is just like, you got to get your heart rate up. You should be breathing a little bit, maybe break into a little bit of a sweat. But another component that people really do miss out on is the resistance training. So resistance training, at least 2 times a week, I think is really, really important. So resistance training is pretty much like a muscle strengthening exercise. And so that's like weightlifting. That's like elastic bands. That could be like body weight exercise or just using actual weights too. So weight bearing and, weight loading activities are really, really important for muscle growth, muscle strengthening, and bone growth as well.
We have oftentimes 10 minutes in between our sessions where we're supposed to write notes, we're supposed to take care of ourselves, grab a snack, go to the bathroom, whatever else. What are some quick little things that people can incorporate during the day? Is it just as simple as drinking more water so that way you have to walk down the hallway to the bathroom every hour?
Hey, that's great. Whatever it takes, for you to get up, that's drinking more water, that's putting your phone across the room, like whatever it takes, honestly. So like you said, if between clients you have just a minute to get up, just standing up helps. Just walking around does really help. If you have some stairs, go ahead, do some stairs, get your heart rate up. But say, you're doing your notes, your documentation, you just really can't pull yourself away from the chair. Honestly, just doing maybe a couple of stretches and things like that in your chair could really help. So I'm going to try to verbalize some exercises and we'll see how that goes. Okay. And then people can interpret as they go.
Google's
interpret
a thing.
Freely.
Yeah,
exactly. Interpret as you need. Exactly. So with this, honestly, the bottom line is the more you move, the better it is. So honestly, if people are moving, that's all I ask for as well. Okay. So the first thing, and we can do this together here as well, since we can, see each other. But the first thing, we're all sitting here. You see how, sitting after a long period of time induces this forward rounded posture, right? Your spine is starting to become this cashew shape. Your head is jutted forward. So let's do some exercises to counter that, right? So the first thing is nice and tall. Katie should know this very well. Thank you, Curt. That looks great. So with the neck, you can start from like top down, right? Starting with your neck, you can roll your neck. You're countering that forward head posture. Good. And then you go the other way, both directions. This one, you go 10 to 20 times each direction, just moving. The next one, shoulder rolls, pulling your shoulders all the way back, making big circles with your shoulders, right? So you feel like your chest is opening up, the back muscles start waking up a little bit. That's promoting that upright posture. Yes, good. Another thing, you can actually just squeeze your shoulder blades together. Katie knows this one very well. Just squeeze it, chest up. You see that just opens up your whole body, right? It just opens up your chest. You're sitting at the desk all day at your computer or doing your documentation. This pulls you the opposite way. Good. To get a little bit more motion, we can do some rotation. So like you said, a lot of people experience a lot of back pain and, spinal pain from a lot of sitting. So this one here, you can cross your arms in front of you just like this. And you're going to rotate as far as you can to the right. Rotate as far as you can to the left. Oh, we look great right now. That looks really good. You see, this is just a great way to start moving your thoracic spine and your lumbar spine as well. All right, we have a couple more. This next one, reach up over all the way up to the sky. You can interlock your fingers if you need to. Do you feel that good stretch there? So you're opening up everything here. You can lean over to your left side. Good for that stretch. Lean over to the right side. Great. And this last one, this is a little bit more of that weight-bearing activity. This is sit to stand. So when you're sitting in the chair, just work on standing up, sitting back down, standing up, sitting back down. So it's a form of a squat or, just weight-bearing activity, which I think would be really good for people.
Those are so easy and they don't take that much time. I think it's just remembering to do it. You mentioned that I'm a weekend warrior. I've talked about on the podcast, I like doing home remodeling and renovation. And so it's not even necessarily good physical activity because it's being in weird positions, hurting my hands, doing all horrible things.
Right.
I am much more active on the weekends during the week. And then we've got Curt, who's like riding his bike into his office. And so he's getting exercise and then sitting. So both of us have these kind of very drastic differences. Is there anything to consider with that? And kind of what we're doing to our bodies.
Yeah, sure. And this is why Katie's coming to see me. But for other weekend warriors out there, like we said before, it's just really important to combat that sedentary lifestyle, right? But, any movement is better than none. So I don't want you to stop doing everything on the weekends. I want you to keep doing that. But one big thing to know is that we're not looking for this huge drastic change in activity, right? So say you're sitting all week and then all of a sudden you do like 5 hours of exercise in a day or two. So a common mistake is that people ramp up their exercises almost too fast and too hard before their bodies have adapted and they're ready for it. So reduce injury overall, we have to increase physical activity gradually and slowly, almost over weeks and months, over time, right? So for example, for sedentary people, mental health therapists that sit a lot, say they're like really not active at all. So you have to start off slow. It's okay if it doesn't feel like a lot, slow is better. So say you can start off with, for a walking program, you can start off with 5 minutes, maybe a day for maybe 4 to 5 to 6 times a week. It feels like not a lot, but your body's still, adapting to that, increase in activity. Or, eventually when you feel like you're a little more comfortable, you can bump up to 10 minutes of walking a day, 3 times a week, right? So you increase either your frequency in which you're doing things or the intensity. So if you want to only walk for 5 to 10 minutes a day, maybe you increase your walking speed to, challenge yourself there. And I think one key component that people really do miss, they think, okay, I got to get my cardio in, I got to do my running, my walking, whatever, but they're missing out on that resistance training, which is so, so important, as Katie knows as well.
Yeah.
So resistance training is super important for like the muscle building, the bone building, everything that we said before. But for people that haven't done it before, you got to start low. You can do 1 time a week with like body weight exercises, right? You can do maybe 1 time a week with light exercises. It's okay. There's no shame in those, those pink dumbbells, the 1 or 2 pounds, right? Curt, like it's okay. You can use them. And then eventually you get to like the 2 times a week, which is the minimum in which we should do. And that's where you can do a little bit more heavier weights as well as you get more comfortable. But it's just allowing your body to adapt to this load that's being put on it. And it really does reduce, the risk of injuries. So Katie, work out through the week. So we're talking
All
about.
right.
Yeah. So the more you can do during the week is great. And then, like I said, just try not to go to that 110% ramp up over the weekend, but gradually get to that point.
That makes sense.
You're talking about cardio and about resistance training here. And admittedly, and I'm a cyclist, I'm a runner. I do a lot of what you're talking about already, but also adding in, I hate stretching. Like I hate warming up stretching. I hate cooling down stretching.
Oh my gosh.
I roll my bike into the office and turn on my fan so I stop sweating and hop on a telehealth call. Like, tell us about stretching, please.
Yes. I will say you most likely need a form of stretching in your life, Curt, unfortunately, because you're very active. You're doing a lot of this aerobic cardiovascular activity, right? But how does your body feel, before and after?
Like I have to hold on to the counter to like bend over and put my shoes on.
So I think you really just proved the point. Yeah. So you really confirm what we're talking about here. So yeah, stretching and then warming up is really, really important. So you're really active. You're doing a lot of this physical activity, but you need to be able to prepare your muscles to get to that level of activity. So going back to the warm-ups, before you go on this, 1 to 2 hour bike ride, 1 or 2 hour run, your muscles and your body need to prepare and get ready for it. It's like you're going to something cold, which is your muscles need to be able to stretch out. They need to warm up. They need to have increased blood flow to that area. So one thing about warm up, it doesn't always have to be the static stretching. It could be dynamic stretching. You can be like hopping around, moving while stretching. So before, big workout, dynamic stretching is actually, I think, more beneficial. But afterwards, as your muscles are in this warm state, it's really important to, stretch out and use the warmth and all that blood flow into the muscles to increase your mobility, right? So you're saying you feel really stiff. You can't reach your toes. You can increase your mobility that way and almost like improve the way you're, biking, running, and doing everything like that in order to, perform better. And then that can also, prevent future injuries in the future. Right. So for example, if you're really, really stiff, you're probably not using, the muscles that you want to be using. Then your body can compensate, right? So by maintaining the, maximal amount of range of motion that you can, that's going to allow you to perform better.
Do you have some specific stretches that are good for folks who have been kind of in this cardio state for a while?
Definitely depends on every individual person, but for like just a generalized, stretching program, the couple of ones that we did earlier where you're just moving your body, that's great too. But, with cardiovascular exercise, it's a lot of like lower extremity work, right? So that could be some, standing hamstring stretches. That could be some standing quadricep stretches. That could be, bending down and reaching your toes. Just getting yourself moving in a dynamic way is going to be good.
I love stretching. So Curt and I are basically the opposite.
I would prefer, great.
Like, give me stretching all day long. But
I know. So Curt,
but then that causes problem too.
Yeah, Curt needs stretching. Oh, I know. Exactly. Curt needs stretching and then Katie needs strengthening. So there we go. We're going to work together as a team there.
So therapists, it sounds like, can really, if we can use that 10 minutes within sessions just to do a few stretches, get up, maybe walk around, just kind of stay active during the week, and also make sure that we're not ramping up too fast like I do on the weekends. We can take care of ourselves. We can feel better in our bodies. And I think probably even just one of the things you had said was kind of making sure that we don't become that cashew shape, kind of crouched over at our desk or in our therapy chair. So I think that helps a lot. But I think there's this other element, and this is something I'm starting to see in the work that I'm doing with my clients, is that and for myself, actually, I was not referred to physical therapy. I asked for it because I was going to be given some sort of pain medication. And it was surprising to me that it wasn't something that was considered, because it means I'm not taking, heavy duty pain medication, and it really helps. I think that there's a missed opportunity that a lot of doctors have, but I think psychotherapists also have insight into how folks are feeling. And so what should therapists know about kind of physical therapy referrals, how to kind of move through that? Because I think obviously we're not medical professionals. We can't say, hey, you need physical therapy, but kind of what might that look like? Because I really feel like not only has physical therapy helped me physically, it's helped my mental health. And so I think it's something where I want therapists to start thinking about this as a possibility, because it is so beneficial.
Right. No, that's a great question. A lot of people don't know, what physical therapy even is. So like you said, that's definitely a missed opportunity. So just so, other health mental therapists know, physical therapy in most states in the country has a form of direct access. So if something happened and you're like, oh yeah, my back really hurts and you don't have time to go see the doctor, you can come to a physical therapist without a physician referral. So that's something that can make us a little bit more accessible to everybody. However, if patients want to go through physical therapy using their insurance, which is more of that common route and that common method. That's what, like Katie, you have to go to your primary care physician or, another orthopedic physician, and then they can get a referral for physical therapy. But I think for mental health therapists and, other healthcare professionals, I think that's a really great point in order to, advocate for your patients. If they go to their physician and they're like, oh, here's pain medication, or, I think you probably need surgery in the future, just do that. You can say, you can suggest physical therapy as an option. I think that's a great way to advocate, like you said, for your patient as well.
Well, I think even just letting them know that that's an option and being able to have them self-advocate with their physician. Because I just had to ask, and he's like, oh, okay. And he wrote a referral. Now my doctor's cool. But
yeah, right.
But I mean, people I've talked to have done the same thing, and they're able to get the referral. I think it's just that a lot of people aren't thinking about it. And it's really more of a kind of organic, authentic way to kind of fix your body versus, kind of medication to kind of cover symptoms or kind of the intrusion of surgery. So for me, it's like, if you can do physical therapy and make it better, it seems like I'm obviously very biased towards physical therapy, but I think it's something that therapists can kind of help folks think about it. Because when we get folks that are chronically ill or have chronic pain, they're usually pretty hopeless.
For a lot of the things that I've come across, or I've, seen sports medicine doctors for things like this in the past, that physical therapy often in people's minds ends up not being the first thought. They think I need to go to a chiropractor. And I've known from talking with physical therapists before of just like a lot of what people are trying to achieve by going to a chiropractor are things that they should be thinking of going to a physical therapist first.
Yeah, that's a common thought that we get too, because chiropractors almost are like that. I don't want to diss the profession at all. They're great chiropractors. Some of them practice in a really great way where they promote this physical activity, right? But a lot of people that go to, chiropractic care, they are looking for that quick fix, right? They have low back pain, they go in, they get manipulated, like, oh, they feel great in that moment. But sometimes it doesn't have like that long-term persistent outcome. So with physical therapy, our focus is really, we do a little bit of that manual work, but that's to prepare you for that, that active recovery, right? Using your own muscles, training your body and training that movement to get that benefit and reduce pain, prevent future injuries.
We talked about this a little bit actually yesterday at physical therapy, and just kind of this idea of therapy, mental health therapy and physical therapy kind of being very beneficial to each other. Maybe we could talk a little bit about that here. What do you see as the way that we might collaborate together as two different types of therapists?
Right. So, as mental health therapists know, physical health is really important and really ties into mental health as well. So I know that, some people can really have a lot of pain. And when people have pain, they're not able to do the things that they want to do. They become dependent on other people. It really affects them mentally. So with that, physical therapy can potentially reduce the amount of pain they're in. They can improve their movement. They can, just get them to allow them to return to a certain level of function, right? So we can create exercises to promote all those things. And like you said, I think this would be a great opportunity, because if, they come into a session with you and they're like, yeah, all they can do is just fixate on their pain. I'm in so much pain. My life is being affected. I don't know what to do. That's where they can advocate for themselves, or you can advocate for them. Like, hey, physical therapy could be an option for you. So then you can address that, physical aspect along with that mental aspect. And then we can really promote that physical activity as well. And we know that physical activity can be great for people. It can be fun. People can be outdoors. They can be with their family and friends. And then that increases their energy levels as well. And I think one thing to really emphasize too is, like, when people think of exercise, they're like, oh no, what a drag. They hate exercise, right? But I think we can really just start promoting physical activity can be fun. We can say that, that's walking with your friends, doing some yoga, swimming, playing tennis with some friends, running if that's fun for you, Zumba, dance class. I think it's really important to find like a meaningful exercise or activity that people can enjoy. And then overall, we know the health benefits of physical activity, physical therapy, movement. It can reduce anxiety. It can, decrease maybe depressive symptoms, decrease stress, all those things like that. And that all ties back to someone's physical and mental health. Like that's interconnected. That's like that mind-body connection. And I think this would be a really great opportunity for us to create this interdisciplinary relationship where we can, approach it from a physical and mental standpoint.
Well, I think the converse is always also true. I'm sure that there are patients that you have who are coming into physical therapy and seem fairly listless, or they're not compliant with the recommendations, those types of things. And so one of the things that therapists can do is actually work on kind of building motivation and follow through and those types of things, so that both of our treatments are more effective. And I think for folks, you and I talked about, this is another potential kind of interdisciplinary referral that can happen. And I think, kind of getting to know your local physical therapist is actually probably a pretty good referral network.
I agree.
What I'm hearing from you, I think, is what we kind of are experiencing across a lot of the field, and especially post-pandemic, of just kind of people trying to get into healthier lifestyles, establishing just kind of not being, remote and telehealth and therefore sedentary a lot. These are things that are pretty consistent with what we've heard as far as, the physical healthy lifestyles of, depression. How many of us refer our clients just to like get more active, just like get out of the house and get moving just for depressive symptoms. And maybe we should have put this disclaimer at the top of the episode, but before any physical activity, make sure that you are checking with your own healthcare professional, and physical therapists are one of those, especially if you are running into, some of these issues yourself. But, this is where oftentimes we can get on this show very much into what's going on in the profession, but really having a focus of like, this is one of those self-care things that allows us to show up day after day. It's one of those things that we can very easily model for our clients of like, these are things that we do to take care of ourselves. It has an impact on improving us. Definitely helps. We'll back up with depression and anxiety symptoms. I've heard some things with some trauma clients as well, that going to trauma-informed physical therapists definitely helps as well. But this is such a vast, important piece of our profession and helping our clients get better. So thank you very much for sharing all of your expertise with us here today. Where can people find out more about you and your practice?
Sure. So as I said earlier, I'm currently working at an outpatient physical therapy clinic. It's actually a physician-owned practice. So it's called Beach Cities Orthopedics Sports Medicine, and it's located in Torrance and Manhattan Beach in California. But, those that aren't local to LA, honestly, I'm open to, fielding any questions, or if you need any referrals to physical therapists or anything like that, feel free to send me an email. So that's celinadpt@gmail.com. And I'm sure, Katie and Curt can put that out there as well.
We'll include that link in our show notes. You can find those over at mtsgpodcast.com. And until next time, I'm Curt Widhelm with Katie Renoy and Celina Caovan.
Thanks again to our sponsor, Thrizer.
Thrizer is a new billing platform for therapists that was built on the belief that therapy should be accessible and clinicians should earn what they are worth. Every time you bill a client through Thrizer, an insurance claim is automatically generated and sent directly to the client's insurance. From there, Thrizer provides concierge support to ensure clients get their reimbursement quickly and directly into their bank account. By eliminating reimbursement by check, confusion around benefits, and obscurity with reimbursement status, they allow your clients to focus on what actually matters rather than worrying about their money. It is very quick and easy to get set up, and it works great with EHR systems.
Their team is super helpful and responsive, and the founder is actually a longtime therapy client who grew frustrated with his reimbursement times. Thrizer lets you become more accessible while remaining in complete control of your practice. Better experience for your clients during therapy means higher retention. Money won't be the reason they quit on therapy. Sign up using bit.ly/modern therapists and use the code modern therapist if you want to test Thrizer completely risk-free. You will get 1 month of no payment processing fees, meaning you earn 100% of your cash rate during that time.
Once again, sign up at bit.ly/modern therapists and use the code modern therapist if you want to test Thrizer completely risk-free.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.